Regarding the occipital bone, articulate with parietal bone through the primary cartilaginous joint. Occipital bone form the lambdoid suture. Occipital condyle are posterolateral to the foramen magnum. Occipital bone articulate with accessory odontoid process. Foramen magnum completely encircled by occipital bone. Regarding the scalp, sensory supply of C1 root do not have any sensory supply for the scalp. In the second layer of scalp from outside, which is superficial fascia, arteries and vessels are in the second layer of scalp from outside, which is superficial fascia. Veins have communication with venous dural sinus via emissary veins. Scalp has blood supply from both internal and external carotid arteries. Regarding the scalp laceration, in the scalp bleed profusely. Neural crest and its derivatives are bones of the skull, adrenal medulla, glial cell, odontoblast. Infratemporal fossa is medially walled by lateral pterygoid plate. Infratemporal fossa communicate with pterygopalatine fossa via pterygomaxillary fissure. Infratemporal fossa is related to three parts of the parotid gland. Trigeminal ganglion is so called Gasserian ganglion or semilunar ganglion or gaseous ganglion. Infratemporal fossa contains the Gasserian ganglion. Infratemporal fossa is separate from carotid sheath by stellate process. Dura mainly consists of fibrous tissue. Dura form the vox cerebri. Dural venous sinus are between last two layers of dura. External vertebral venous plexus lie anterior to the vertebral body. The denticulate ligamenta are bilateral triangular lateral extensions of the pia mater that anchor the spinal cord to the dura mater. Carotid triangle upper border formed by anterior belly of the digastric muscle. Carotid triangle hyoglossus from the medial wall. Carotid triangle contains superior root of ansa cervicalis. Carotid triangle bifurcation of common carotid arteries at the upper border of the thyroid cartilage. Carotid triangle contains superior thyroid artery. CSF is produced by choroid plexus. CF is found in the ventricle. CSF has a total volume of about 130 milliliter. Only the posterior half of trigeminal ganglion is bathed in CSF. Cranial nerve passes between glossopharyngeal nerve passes between external and internal carotid artery. Levator bulbar superior sympathetic supply is via the oculomotor nerve. Branches of the mandibular nerve are common stem, medial pterygoid, meningeal branch, posterior branchial mainly sensory, buccal branch to remaining muscles of mastication, anterior branch mainly motor, auriculotemporal, anterior alveolar lingual. Coda tympani mediates taste sensation and inguinal nerve, the general sensation of the anterior two-third. Auricular branch of the vagus supply the posterior anterior quadrant of tympanic membrane. Regarding the blood supply of the brain, inner ear supplied by basilar artery, the bilabyrinth artery. Middle meningeal artery is extradural. Posterior cerebral artery supply the visual cortex. The macular region may be supplied by the middle meningeal artery. Superior cerebral vein drains to the superior superior sagittal sinus. Cavernous sinus communicate with the facial vein. Therefore, infections in the face may cause cavernous sinus thrombosis. Basal ganglion, caudate nucleus and putamen together form the striatum. Caudate and lentiform nucleus equal to corpus striatum. Third ventricular floor is formed by subthalamus, hypothalamus. Subthalamic nucleus is a point of basal ganglia circuit. Main function of basal ganglia circuit selection of pre-programmed motor function. Blood supply derived from penetrated branch of anterior and medial cerebral artery. Basal ganglia ascend through the anterior perforate substances. Limbic system include amygdaloid body, olfactory cortex, parahippocampal gyrus, cingulate gyrus. Regarding the cerebral cortex, parieto-occipital sulcus is parallel to central sulcus. Giant pyramidal cell of brain located in the internal pyramidal cell layer. Axons from these leaves the cortex of cerebrum and connect with subcortical structures including the basal ganglia. Wernicke's area is located on the superior temporal gyrus. Brainstem derived from rhombocephalon. Fibers from the vestibular nuclei reach the cerebellum via the inferior cerebellar peduncle. Sympathetic system is involved in medullary infarction. In lateral medullary syndrome, Horner syndrome is evident. Hypoglossal nucleus is adjacent to the inferior cerebral peduncle. Very good. Hypoglossal nucleus is a medial structure in the MO. Nucleus ambiguous supplied bronchial muscle, supplied trapezius muscle via the accessory nerve. Regarding the skull, lower border of the orbit and superior border of the external auditory meatus are on the same plane. The optic foramen is in the sphenoid bone. In the foramen lacerum, the greatest petrosal nerve join with deep petrosal nerve to form the nerve of pterygoid canal. Mastoid process is an extension of temporal bone. Anterior branch of the middle meningeal artery lies adjacent to the pterion. Regarding the spine and spinal cord, cervical spine has a natural lordotic curve. Lordotic when we hold a load on hands, anteriorly convex. Spondylolisthesis occurs fourth and spondylolisthesis occurs fourth and fifth lumbar vertebra. This disease causes one of the lower vertebrae to slip forward onto the bone directly beneath it. The joint between vertebral bodies is secondary cartilaginous joint. Symphysis is ampiarthrosis. The dentate ligament made up of pia major, pia extending lateral to joint dura. True false. Scalp wound tend to bleed profusely. Even there is smooth muscle, it cannot constrict since they are held firmly by surrounding connective tissue. Scalp blood vessel. Mandibular division of the trigeminal nerve supply the skin of the mandible. An infection of the ala of the nose can give rise to cavernous sinus thrombosis. Ala of the nose is within the danger area of face. Right side of parotid deviation take place to left since the tone of the side muscles are intact. Tip of the nose is supplied by the external nasal branch, which is the continuation of anteroethmoidal nerve. Triangle. Regarding the triangle of the neck, the floor of the posterior triangle is formed by the prevertebral fascia. Enlarged supraclavicular lymph nodes are felt in the posterior triangle. Internal jugular vein can be accessed for catheterization through the two heads on the of the sternocleidomastoid. Submandibular gland can be palpated in digastric triangle. Pretracheal fascia split to enclose the gland. Regarding the ear, foot plate is attached to the tympanic membrane. Altered taste following ear surgery is damage to the chorda tympani. Taste sensation in the anterior two-thirds of the tongue is altered. Tegmentum tympani separates the middle ear cavity from middle cranial fossa. Tegment tympani forms the roof of the middle ear cavity. Regarding the ear, facial nerve runs on the posterior wall. Regarding the ear, utricle and saccule carry sensory receptors responsible for balance and posture. Regarding the larynx, glottis is the space between two vocal cords or rima glottis. External laryngeal nerve innervates the cricothyroid, which is a tensor muscle. Brachiosac space is potential base under epithelium of true vocal cords. Between the thyroid cartilage and cricoid cartilage lies the cricothyroid membrane. Vallecula is formed by glossoepiglottic wall, bound by medial and lateral glossoepiglottic wall. Regarding the eye and orbit, superior oblique depress the eye in adducted position. This is the sole depressor of the eye in adducted position. Unilateral damage to abducens nerve cause double vision. Unilateral damage to inferior division of oculomotor nerve cause loss of adduction. Medial rectus is supplied by the inferior division. Mnemonic LFT sonia. LFT structure passing outside. Lacrimal nerve, frontal nerve, trochlear nerve. Sonia structures passing inside. Oculomotor nerve, superior and inferior branches. Nasillary nerve, adducens nerve. Splinter pupilla is supplied by edingevestibular nucleus, parasympathetic nucleus. Regarding the vessels of the head and neck, external carotid artery has pharyngeal branches. C4 upper border of thyroid cartilage. Sometimes C3. Internal carotid artery lies anterior to the internal jugular vein at the base of the skull. Carotid canal is placed anterior to the jugular foramen and bulb. Accessory middle meningeal artery is a branch of the maxillary artery, given off by the first part of the maxillary artery. Ophthalmic artery anastomos is the external carotid artery. Regarding the cerebellum, horizontal fissure do not separate lobes. Regarding cerebellum, contain Golgi cell. Receive afferent from proprioceptive organs. Unconscious proprioception. Regarding cerebellum, inferior cerebellar peduncle joined to the medulla oblongata. Planning is done at cerebrum. A 20-year-old man developed right foot drop. He also complained tingling over the dorsum of the foot. Examination showed he had severe weakness of the right ankle and the toe dorsiflexus and ankle elevatus. The deep tendon reflexes, inclusive of ankle reflex, were intact. There were decreased sensation over the dorsum of the right foot, extending up the lateral leg just below the knee. Probable site for the lesion, common peroneal nerve. Fifth lumbar spine nerve. Regarding the temporomandibular joint, opening of the mouth is performed by all muscle running between the mandible and the hyoid bone. Depression. Mechanoreceptors and send afferent to mesencephalic trigeminal nucleus. Proprioception. Temporomandibular joint is supplied by the auriculotemporal nerve. Regarding temporomandibular joint, condyle and hinge type. Regarding temporomandibular joint, lies anterior to the coda tympani. Coda and tympani exit the skull at patellotympanic fissure. Clinical features of consisting of contralateral hemiplegia, contralateral hemi-sensor loss and homonymous hemianopia are due to occlusion of the following arteries. Anterior choroidal artery, middle cerebral artery. Inferior half of the posterior limb of the internal capsule is supplied by the anterior choroidal artery, while the superior half is by the middle cerebral artery. Optic radiation is supplied by the anterior part, anterior choroidal artery. Middle part, middle cerebral artery. Posterior part, posterior cerebral artery, calcarine artery branch. Which of the following cranial nerves or nuclei are involved in the motor supply to palatine muscles? Trigeminal motor nucleus, glossopharyngeal nucleus ambiguous. Palatine muscles are supplied by the vagus nerve, except stylopharyngeus, which is by glossopharyngeal nerve. The motor nucleus of both nerves are nucleus ambiguous. The scalp has venous connection with superior sagittal sinus. Scalp extends anteriorly beyond the frontal hairline. C1 has no cutaneous supply. Scalp is supplied by posterior rami of C2 and C3. No lymph nodes in scalp. Occipitofrontalis are the scalp nucleus. Temporal is the muscle of mastication. Regarding cerebellum, don't eat good food. Reform from lateral to the medial. Dentate, emboliform, globose, vestigial. Arc cerebellum, flocculonodular lobe, paleocerebellum, firmis and paravermis. Neocerebellum, the rest. Inferior cerebellar peduncle carries vestibulocerebellar tract. No efferent cerebellar outflow is found in the middle cerebellar peduncle. Corticopontocerebellar dentothalamus cortical tract transmit the cerebellar information. Regarding trigeminal nerve, parasympathetic to this lacrimal gland is where the facial nerve, greater petrosal nerve, preganglionic parasympathetic fibers. Bimandibular division carries sensory information from the floor of the mouth. Mandibular branch of the trigeminal nerve is derived from the first pharyngeal arch. Trigeminal nerve carries caves posterior inferior to the cavernous sinus. Maxillary division leaves the skull through the foramen rotunda. Regarding the vertebral triangle, inferior thyroid artery lies at the apex of the triangle. Regarding the vertebral triangle, contains vertebral artery. Regarding vertebral triangle, lies medial to scalene and anterior muscle. The triangle of the vertebral artery, this deep triangle of the neck, is bound by subclavian artery and the anterior scalene and longus cervicis muscle. Regarding the frontotemporal fossa, medial wall is formed by lateral pterygoid plate is communicate entirely with the pterygopalatine fossa. Parotid gland secretometer fibers synapse in the otic ganglion. Inferior alveolar nerve pass between medial pterygoid and lateral pterygoid nucleus. The larger deep head arises from the medial surface of the lateral pterygoid plate. The small slip of muscles. The superficial head arises from the tuberosity of the maxilla and the pyramidal process of the palatine bone. Regarding tissue spaces of the neck, prevertebral space lies anterior to the prevertebral fascia. Prevertebral fascia fuses with antevertebral ligament at T4 level. Retropharyngeal space is connected with the superior mediastinum. There is a continuation space that extends from the base of the skull up to the diaphragm, passing through the superior and posterior mediastinum. Vagus nerve is within the carotid sheath. Ludwig angina is an infection that involves both submandibular and sublingual space. Regarding the ear, incusido-stapedial joint is synovial. Also, the incudo-malleolar joint is synovial. A defect in tegmentum tympan leads to leak CSF. Tegmentum tympan is a thin bone between the middle cranial fossa and the middle ear cavity. A defect in tegmentum tympan leads to leak CSF into middle ear. Utricle sends the lining acceleration regarding the ear. Eustachian tube open into the anterior wall. Tensor tympan prevents the tympanic membrane from the being damaged when exposed to excessive noise. Damage causes hyperacusis. Regarding blood supply, maxillary artery supply muscles of the mastication. Facial artery supply the palatine tonsil, it ascending palatine branch. Ophthalmic artery supplies the ethmoidal sinus, anterior and posterior ethmoidal branches. Middle meningeal artery supplies the middle meninges. Occlusion of anterior spinal artery at the level of the T12 will cause bilateral motor loss below the T12 vertebra. Anterior two-thirds of the spinal cord is supplied by the anterior spinal artery. Left hemisection of spinal cord at level of T4 result loss of touch on the dorsum of the foot. In hemisection, loss of touch sensation contralateral side 2 to 3 segment below the lesion. Loss of sensation of the vibration in the left big toe. In hemisection, loss of vibratory sensation in ipsilateral side below the lesion. Not all sensation are lost in contralateral side sensations such as vibration are intact. Spastic paralysis of flexor muscle, upper motor neural lesion, UML lesion. Flexor muscles of lower limb are obviously affected in ipsilateral side. Hypotonic ipsilateral muscle weakness in the same spinal level left side. Since the spinal roots are affected, LML lesion. True or false? Joint in the skull walls are fibrous joint. Foramen spinosum transmit the middle meningeal artery. Maxillary division of the trigeminal nerve is transmitted by foramen rotundum. True or false regarding CNS? A habenuclear nucleus is a part of epithalamus. The epithalamus include the habenula and their interconnective fibers, the habenula commissure, the stria medullaris and spinal gland. Damaged visual cortex resulted in quadrantopia which macula is sparing. The right visual cortex above the calcarine sulcus get fibers from the right superior quarter of the retina. Cortex is responsible for the macula part, sometimes have a separate blood supply. Entrails receives SVA special visceral and afferent fibers. SVA inside afferents from baroreceptors. This is true for fasciculus cuneatus. Fasciculus gracilis carry fibers from spinal nerves below T6 thoracic spinal nerve. First order neurons of pain fibers synapse at the nucleus proprioris. Lateral spinothalamic tract. Regarding the cavernous sinus and supraorbital fissure, nasociliary nerve goes through tendinous ring. Left is sonia. Explanation is given. Internal Abducens nerve goes infralateral to the internal carotid artery. Trochlear nerve crosses the oculomotor nerve on the lateral wall of the cavernous sinus. Maxillary nerve goes in the lateral wall of the cavernous sinus. Internal carotid artery aneurysm causes it may affect the opposite as well as since both sinuses are interconnected. Exophthalmos is bulging of eyes anteriorly. Corneal reflex. Cornea is the only touch-sensitive part of the eye. Unilateral damage in ancillary nerve damage. Ancillary fibers carry the sensory fibers. Bilateral damage in cranial nerve 7. Corneal reflex ability to close the eye is lost. Glabellar tap induces the blink reflex. Under repetitive tap, subject blink in response to first several taps. If blinking present, then it abnormal. This is seen in Parkinson. Regarding the ear, the tympanic annulus insert into the tympanic sulcus, a shallow groove of the external acoustic canal, attacking the tympanic membrane to the EAC pars antensa. Annulus is diffusion superior pars flaccida. At the rest of mastoid opens in the posterior wall of the middle ear. Facial canal lies anterior and inferior to the lateral semicircular canal. The stapedius muscle attacked the stapedius. The name of the muscle gives the hint. Components of the limbic system are amygdaloid nucleus, hippocampus. In the bony orbit, lesser wing of the spinal form the optic canal. Ethmoid bone is thinnest bone of the orbit. Palatine bone contribute to the flow of the orbit. Regarding the embryological development, stomatium is lined by ectoderm. Upper lip is derived from the lateral nasal prominence. Medial nasal prominence do not take part in upper lip formation. First pharyngeal pouch derivatives are tympanic cavity and notative. Mesentery forms from the it is supplied by mandibular nerve, therefore derivative of first arch. Mesentery it is supplied by mandibular nerve, therefore derivative of first arch. Nasal lacrimal duct is between maxillary and lateral nasal prominence. A 30 years old female muscle teacher undergo complete thyroidectomy. Few days she noticed that she has difficulty singing. On clinical examination, physician found that her vocal cord movement are abnormal. What are the structures that can be damaged? Recurrent laryngeal nerve, external laryngeal nerve. Nerves related with superior and inferior thyroid artery are the vulnerable structures. Regarding the ciliary body, is a component of uveate tract. Absorbs regarding ciliary body absorbs aqueous humor. Ciliary body is attached to the lens by sonules. The uveal tract is a layer of tissue located between the outer layer, cornea and sclera, and the inner layer, the retina of the eye. The front portion, atria of the uveal tract, contains the iris, and the back portion, posterior of the uveal tract, contains the choroid and stroma of the ciliary body. Regarding the retina, optic nerve is formed by the excess of bipolar cells. Outer nuclear lamina contain nuclei of photoreceptors. Regarding the retina, supplied by end artery, central retina artery. Retinal detachment causes blurry vision if not treated blindness.